Good day, we are the Group 5 and we are going to present our output from the Worksheet 3, the musculoskeletal system. So I'll be the first reporter. I am Krishafate B. Palomaria. I'm going to present the pages 2 to 6. So let's get started. Let's begin. The first part is we have here the stepping in, the overview of the skeleton. Bone markings, we have here column A and column B. 1. Sharp slender process, spine. 2. Small rounded projection, tubercle. Large rounded projection, tuberosity. 4. Structure supported on neck, head. 5. Arm-like projection, ramus. 6. Rounded convex projection, condyle. 7. Canal-like structure, meatus. 8. Round or oval opening to a bone, foramen. 9. Shallow depression, fossa. 10. Air-filled cavity, sinus. 11. Large irregularly shaped projection, trochanter. So let's proceed to the page 4, the classification of bones. Number 2, the major anatomical classifications of bones are long, short, flat, and irregular. Which category has the least amount of spongy bone relative to its total volume? So the answer is the least category has the least amount of spongy bone relative to its total volume is the long bones. So we have here number 3, we have here a graph. I am going to classify each of the bones in the following chart into one of the 4 major categories by checking the appropriate column. We have here humerus, that is a long bone, phalanx, a long bone, parietal, that is a flat bone, calcaneus, that is a short bone, rib is a flat bone, vertebra is irregular bone. The next one, number 4, we have here the gross anatomy of the typical long bone. So we have here a long bone. So I'm going to identify the structure marked by leader lines and brackets in the diagram. Okay, so we have here number 1. It is the proximal epiphysis, 2. Diaphysis, 3. Distal epiphysis, 4. Spongy bone, 5. Epiphyseal line, 6. Medullary cavity, 7. Red marrow, 8. Articular cartilage, 9. Endosteum, 10. Compact bone, 11. Yellow marrow, 12. Periosteum, 13. Compact bone, 14. Articular cartilage, 15 is trabeculae of spongy bone. So we are done in labeling the diagram, and let's use the listed terms to characterize the statement following the diagrams. So number 1, made almost entirely of compact bone, that is diaphysis. 2. Site of blood cell formation, red marrow. 3. Fibrous membrane that covers the bone, periosteum. 4. Scientific term for bone end, that is epiphysis. 5. Contains fat in adult bones, yellow marrow. 6. Growth plate remnant, that is epiphyseal line. Let's move on with the number 5. What differences between compact and spongy bone can be seen with the naked eye? The differences between compact bone and spongy bone can be seen in naked eye. The compact bone is very smooth, dense, and thick, while spongy bone has a lot of open spaces. It is best to describe a structure that looks like a sponge. And after that one, we have here chemical composition of bone. We are still in page 5. Number 6, what is the function of the organic matrix in bone? The function of the organic matrix in bone provides mechanical strength and flexibility. 7. Name the important organic bone component, collagenous and elastic fibers, ground substances, and cells. 8. Calcium salts from the bulk of the inorganic material in bone. What is the function of the calcium salts? So the function of the calcium salt is to provide hardness and strength. So we have here inorganic, number 9, inorganic portion or bone salts, organic portion or both contribute. So the question is, which is responsible for bone structure? It is both contribute. Responsible for bone structures are inorganic portion and organic portion. Lastly, we have here in page 6, number 10, the microscopic structure of compact bone. So let's trace the route that nutrients take through a bone, starting with the periosteum and ending with an osteocyte in a lacuna. So the first one is the periosteum. Second is perforating canal. Third is the central or Haversian canal. Fourth is canaliculus, and the last one is the osteocyte. Lastly, in number 11, we have here the photomicrograph. Let's identify all structure listed in the key to the left. Okay, I have here the numbers 1 to 5. 1 is canaliculi, 2 lamella, 3 lacuna, 4 central canal, and the last one, number 5, is bone matrix. So that's it in my report in from pages 2 to 6, and I will give this floor to our next reporter. Thank you.
Hi ma'am, I'm Elton January. I'm here to report number 2, the axial skeleton. Number 1, bony thorax and vertebrae, and it protects the brain. Number 2, Sherlock joints, movable joint that connect bones of skull. Number 3, mandible. Number 4, sagittal, two parental bones, coronal, parental meet frontal bones, squamous, temporal meets parental, lam, lambdoid, occipital meets parietal. Number 5, frontal, ethmoid, right temporal, left temporal, right parietal, left parietal, sphenoid, and occipital. Number 6, light facial bones act as resonance chambers for speech. Number 7, bony cavity containing the eyeball. Number 8, because it forms in platae across with the skull. Next, 9, match the bones in column B with the description in A. Number 1, frontal. Number 2, zygomatic. Number 3, maxilla. Number 4, nasal. Number 5, palatine. Number 6, parietal. Number 7, temporal. Number 8, sphenoid. Number 9, lacrimal. Number 10, maxilla. Number 11, ethmoid. Number 12, temporal. Number 13, sphenoid. Number 14, ethmoid. Number 15, maxilla. Number 16, frontal, sphenoid, and ethnoid. Number 17, occipital. Number 18, occipital. Number 19, hyoid. Number 20, mandible. Number 21, vomer. Number 22, mandible, maxilla. Number 23, ethmoid. Number 10, using choose from column B in question and from the key to the right, identify all bones and bones making provide with leader line diagram below. There are frontal, suture, middle nasal concha, ethmoid bone, inferior nasal vomer bone, mandibular symphysis, maxilla, infraorbital foramen, zygomatic bone, lacrimal bone, ethmoid bone, temporal bone, sphenoid bone, greater wing, parental bone, frontal bone, coronal suture, and sagittal suture. Next, the fetal skull. Are the same skull bones present in adult also found in the skull? Yes. Number 12. Face the forest shortened, overshadowed by large cranium. How does compare to the adult skull? In adult, the cranium is proportionately smaller and the facial bones are proportionately larger and more prominent. Number 13. What are the outward conical projections in some fetal cranial bones? A fontanelle, a fibrous membrane connecting fetal skull bones. Number 14. What is fontanelle? Space between the bones of the skull in an infant or fetus where occipation is not complete and sutures not fully formed. The main one is between frontal and parental bones. What is fate? Its fate is a soft spot in the skull of an infant. What is the function of the fontanelles in the fetal skull? They allow.
So now, let's proceed to the next part. This is Juan Soldevilla Palencia reporting. So, the vertebral column. We are going to identify now the vertebral parts or areas described below. Number 1, I. Vertebral foramen is a cavity enclosing the nerve cord. Number 2, A. Body, weight-bearing portion of the vertebra. Number 3, E. Spinous process and G. Transverse process provides levers against which muscles pull. 4. F. Superior articular facet and G. Transverse process provides an articulation point for the ribs. Number 5. B. Invertebral foramina is opening providing for exit of the spinal nerves. Number 6. C. Lamina and D. Pedicle are the structures that form an enclosure for the spinal cord. Number 17 here, number 1 answer is the thoracic vertebra, a vertebral type with a bifid forked spinous process. Number 2, axis, pivots on C that lacks a body. Number 3, thoracic vertebra, bare facets or articulation with ribs form part of the bony thoracic cage. Number 4, sacrum, forms a joint with the hip bone. Number 5, lumbar vertebra, vertebra with block-like body and short, stout spinous process. Number 6, coccyx, aka tailbone. Number 7, atlas, articulates with the occipital condyles. 8, lumbar curvature, has 5 components and fused. 9, thoracic vertebra, has 12 components and fused. Number 10, sacrum, 5 components fused. Now let's move on to number 18, identifying each of the vertebrae and labeling the following markings. So on the left side, we can see here the rib facet, and it is a thoracic vertebrae. And on the right side here, we have vertebral foramen and lamina. Both are cervical vertebrae. So number 19, answer is the fibrocartilage, is a kind of tissue that makes up the invertebral disc. Number 20, it is when a part of the nucleus pushes through a break in annulus. So it is a herniated disc. So what problems might it cause? It reduces the disc ability to cushion the joints of the vertebrae, resulting in back pain and reduced mobility. So number 21 here, shown on the upper part, we have atlas, axis, then the two thoracic vertebrae. Then on the middle part is here we can see the invertebral disc. Next is the two lumbar vertebrae and the scrotum. 22. The major components of the body thorax, excluding the vertebral column, are the sternum and the ribs. 23. What is the general shape of the thoracic cage? So the thoracic cage is conical in shape. Next, shown here on the number 24, on the right side, we have the costal cartilage. Below is the 7 true ribs and 4 false ribs. And on the right side here, the 3 sternum, manubrium, which forms the superior wall of the anterior, mediastinum and its superior border. Next is body, and lastly the xiphoid process. Number 25, differentiate a true rib from false rib. So true ribs are the first 7 pairs attached directly to the sternum. False ribs has 4 pairs. So number 26, what is a floating rib? So it is 11th and 12th ribs that are not attached directly to the breastbone. In the next part, we will have now our next reporter.
Good day! I am Peralta Shana Tenchibi, and I would be reporting the appendicular skeleton, bones of the pectoral girdle and the upper limb. For number 1, we have the scapula. Inferior to the scapula, we have the deltoid tuberosity. Superior to the scapula, we have the greater tubercle, acromion, coracoid process, and the number 2, we have the clavicle. Next, number 3, we have the humerus. Inferior to the humerus, we have the coronoid fossa, lateral epicondyle, capitulum, medial epicondyle, trochlea, coronoid process, and the radial tuberosity. Next, number 4, we have the radius. Inferior to the radius, we have the styloid process. Next, we have number 5, ulna. Also inferior to the ulna is the styloid process. Number 6, we have carpals, 7, metacarpals, and 8, the phalanges. For number 2, we have the matching type, match column A to column B. Number 1, we have raised area on the lateral surface of humerus to which deltoid muscles are attached. The answer is deltoid tuberosity. Number 2, also known as the arm bone, is the humerus. Number 3, we have bones of the shoulder girdle, which is the clavicle and the scapula. For number 4, forearm bones. It is the radius and the ulna. Number 5, scapular region to which the clavicle connects. It is the acromion. Number 6, shoulder girdle bones that is unattached to the axial skeleton. It is the scapula. Number 7, shoulder girdle bone that articulates with and transmits forces to the bony thorax. It is the clavicle. Number 8, depression in the scapula that articulates with the humerus. It is the glenoid cavity. Number 9, process above the glenoid cavity that permits muscle attachment. It is the coracoid process. Number 10, the collarbone. It is the clavicle. Number 11, distal condyle of the humerus that articulates with the ulna. It is the trochlea. Number 12, it is the medial bone of forearm in anatomical position. It is the ulna. Number 13, rounded knob on the humerus, articulates with the radius. It is the capitulum. Number 14, anterior depression superior to the trochlea that receives part of the ulna when the forearm is flexed. It is the coronoid fossa. Number 15, forearm bone involved in formation of the elbow joint. It is the ulna. Number 16, wrist bone. It is the carpals. 17, finger bones are also known as the phalanges. 18, head of these bones from the knuckles. It is the metacarpals. And number 19, bones that articulate with the clavicle. It is the scapula and the sternum. Next, we have for number 3, why is the clavicle at risk to fracture when a person falls on his or her shoulder? When a person falls on his or her shoulder, the clavicle is most likely to be at risk to fracture because the middle third of the clavicle is the thinnest and it has lack of support by muscles and ligaments. In other words, the clavicle is fragile, so it's more vulnerable to fractures. Number 4, the scapula has no direct attachment to the axial skeleton. How does this affect the movement of the shoulder? The scapula has no direct attachment to the axial skeleton, but it's loosely held in place by trunk muscles, which enables the shoulders to move. Next, we have number 5. What are the total numbers of phalanges in the hand? There are a total of 14 phalanges in the hand. Number 6. What are a total of carpals in the wrist? There are a total of 8 carpals in the wrist. Next, bones of the pelvic girdle and the lower limb. Number 7. Compare the pectoral and pelvic girdles in terms of flexibility, security, and the ability to bear weight. For flexibility, the pectoral girdle is more flexible than the pelvic girdle because it has less ligaments and has a shallow socket joint than the pelvic girdle. For security, the pelvic girdle is more secure because it has a deeper socket joint compared to the pectoral girdle. For the weight-bearing activity, the pectoral girdle has a slender and fragile bone called the clavicle, so it has a less ability to bear weight compared to the pelvic girdle. Next, number 8, what organs are protected, at least in part, by the pelvic girdle? The organs protected by the pelvic girdle are the uterus, the bladder, small intestine, rectum, and the reproductive organs. Number 9, distinguish the true pelvis from the false pelvis. The greater pelvis or the false pelvis lies superior and anterior to the pelvic brim, while the true pelvis is inferior to the pelvic brim. For number 10, identify the bone markings on the illustration of the causal bone. For number 1, we have the ilium. Next to the ilium, we have the iliac crest. Inferior to the ilium, we have the anterior superior iliac spine and the greater sciatic notch. For number 2, we have the pubis. Superior to the pubis, we have the acetabulum. We also have obturator foramen. For number 3, we have the ischium. Superior to the ischium, we have the ischial tuberosity. And also, we have the ischial spine. Next, we have number 11. The pelvic bones of a four-legged animal such as a cat or pig are much less massive than those of human. Make an educated guess as to why this is so. For number 11, the pelvic bones of a four-legged animal are much less massive than those of humans because it does not have to carry the entire weight of the trunk, because the weight is divided among their four legs. For number 12, a person instinctively curls over the abdominal area in times of danger. Why? For number 12, a person instinctively curls over the abdominal area in times of danger to protect the vital organs located there, because there are no bones in that area. Once again, I am Peralta Shana Tenchibi. That's all for my report. Let's now move on to the next reporter.
Good morning, everyone. By the way, thank you for that wonderful presentation. By the way, I am Miles Angela Amascara, and I am tasked to report for the Part 4 and Part 5, which is the joints and body movements and gross anatomy and muscular system. So let us start. In here, we need to identify the joint types described below. So first, it is typically a slight degree of movement. It is cartilaginous. Number 2, include the joints between the vertebral bodies and the pubic symphysis. It is still cartilaginous. For the number 3, it is essentially immovable joints. It is fibrous. Number 4, sutures are the most remembered example. Still, it is fibrous. Number 5, cartilage connect the bony portions. Number 5 is still cartilaginous. For the number 6, we have a fibrous articular capsule lined with a synovial membrane surrounding a joint cavity. It is synovial. 7. All are freely moved or they are orthic. Number 8. Bone regions are united by fibrous connective tissues. It is fibrous. Number 9. It include the hip, knee, and elbow joints. It is synovial. Okay, for the number 2, it is a matching type. So, for the number 1, we answered suture. Number 2, pivot. Number 3, ball and socket. Number 4 is condylor. Number 5 is hinge. Number 6 is hinge. Number 7 is plain. Number 8 is condylor. And number 9 is ball and socket. For the next item, what characteristics do all joints have in common? Characteristics that all joints have in common are all joints allow movement in one plane. They also allow movement in two directions. Joints support all angular and rotational movement. All are made up of bony regions that are divided by fibrous or cartilaginous connective tissues. Next is I am tasked to describe the structure and function. For the ligament, it is a fibrous connective tissue that connects bone to bone and is used to hold things together and keep them stable. Articular cartilage. It is the smooth white tissue that covers the end of bones where they come together to form joints. Healthy cartilage in our joints makes movement easier. It enables the bones to slide over one another with little friction. Injury or natural wear and tear can both degrade articular cartilage. For the synovial membranes like the gaps between moving bones and joints, they are classed as connective tissues membranes because they are smooth and sleek and secrete a thick colorless lubricating fluid known as synovial fluid. Bursa. The bursa acts as the cushion between muscle, ligaments, and bones, allowing structures to glide and slide past one another with minimum friction. A bursa injury can result in pain, reduced motion, and diminished functional mobility. Still in number 4, we have here periosteum ligament, joint cavity, articular cartilage, fibrous capsule, and lastly, synovial membrane. Number 5. Which joint, the hip or the knee, is more stable? The hip is more stable. Number 5, name 2 important factors that contribute to the stability of the hip joint. So it is the acetibular labrum and ligamentum teres. For the movements that are allowed by synovial joints, during muscle contraction, the insert moves toward the origin. For the number 7, we are tasked to complete the description below. So A. Flexion at the elbow. B. Extension at the knee. C. Abduction of the lower limb. Still, D. Abduction of the lower limb. E is circumduction of the upper limb. F is the inversion of the foot. G is the rotation of the head. For the joint disorders, number 8, what structural joint changes are common in older people? The joint changes that are common in older people is the degenerative changes or adhesions and bone spurs. It is to begin to sprout up in the thoracic joint and intervertebral discs begin to degenerate. These changes lead to increased joint stiffness and pain. As you age, joint movement becomes stiffer and less flexible because the amount of lubricating fluid inside your joint decreases and the cartilage becomes thinner. Ligaments also tend to shorter and lose some. For the number 9, define dislocation. So dislocation is an injury to a joint where two or more bones come together in which the ends of your bones are forced from their normal positions. It is also a condition where the bones of a joint are knocked out of place. This injury temporarily deforms and immobilizes your joint. Part 5, Gross Anatomy of the Muscular System, Muscle of the Head and Neck. For the number 1, we are tasked to correctly identify the muscle provided with leader lines on the diagram. Okay, we have here cranial aponeurosis, frontalis, occipitalis, orbicularis, oli, zygomaticus, buccinator, masseter, orbicularis oris, and lastly, platysma. For the number 2, still we are tasked to identify the muscles described next. First is used to grin. It is zygomaticus. Number 2, muscle used during whistling. It is orbicularis oculi. Next is used in blinking and squinting. Still orbicularis oculi. Number 4, its contraction makes the sound clone. Face pulls the corners of the mouth and downward. It is the platysma. Number 5, raises your eyebrows for a questioning expression. It is the frontalis. Number 6 is your kisser. It is the orbicularis oris because it is the mouth. Number 7 allows you to bite the carrot stick. It is the masseter. And lastly, tenses skin of the
Good
neck
day, ma'am.
during
I'm Chelo
shaving. It
Novales
is
and I'm
the
tasked
platysma.
to
And that
identify the
is
major
all
muscles
about my
of trunk,
part.
upper
Next, we
limb,
will
and
have
lower limb.
Chelo.
Let's start to the muscles of trunk and the upper limb. Number 1, a major spine flexor. The answer is rectus abdominis. It is found in the pubis. It flexes the vertebral column or spine. Number 2, prime mover for pulling the arm posteriorly. So that is latissimus dorsi. It is located in the lower spine in iliac crest. It extends and adducts the humerus of the long humerus or the long bone of the upper arm. Number 3, elbow extender. Answer is triceps brachii. Its origin is in the shoulder girdle and the proximal humerus. Number 4, helps to form the abdominal girdle. There are 4 pairs of muscles that can be found in the abdomen: the internal oblique, external oblique, transversus abdominis, and rectus abdominis. Number 5, extends and adducts the wrist. That is extensor carpi ulnaris. Number 6, allows you to raise your arm laterally. The answer is deltoid. Its origin is in the scapular spine and clavicle. It also adducts the humerus. Number 7, shoulder adductors. There are 2 muscles, the latissimus dorsi and the pectoralis major. There are the muscles that allow us to move our shoulders. Number 8, flexes elbow and supinates the forearm. The answer is biceps brachii. Number 9, small muscles between the ribs. It is intercostals. Number 10, extends the head. So the answer is trapezius. It can be found in the occipital bone and all cervical and thoracic vertebrae. It can also raises, retracts, and rotate the scapula. Number 11, extends the spine. It is erector spinae. Number 12, extends and abducts the wrist. That is extensor carpi radialis. So let's move on to muscles of the lower limb. Number 1, lateral compartment muscles that plantar flexes and everts the ankle. That is fibularis peroneus muscles. Number 2, forms the buttocks. That is gluteus maximus. It also extends the hip. Number 3, a prime mover of ankle plantar flexion. The answer is gastrocnemius. It is located in the distal femur. Number 4, a prime mover of ankle dorsiflexion. That is tibialis posterior. Number 5 allows you to grip horse's back with your thighs. The answer is abductor group. Number 6, muscles insert in the tibial tuberosity. Tuberosity. That is, there are two muscles, the rectus femoris and the vastus muscles. Number 7, muscles that extends the thighs and flex the knee. So there are three muscles, the semitendinosus, semimembranosus, and biceps femoris. Number 8, prime mover of inversion of the foot. That is posterior tibialis. Number 9, prime mover of dorsiflexion of the foot. So the answer is tibialis anterior. So number 10, adducts the thigh when standing at attention. That is adductor group. Number 11, extends the toe. So the answer is extensor digitorum longus. It is located in the proximal tibia and fibula. Number 12, extends the knee and flexes the thigh. It is rectus femoralis. Number 13, used to extend the hip when climbing the chair. That is gluteus maximus. Number 14, prime movers of plantar flexion of the foot. That is gastrocnemius. So, okay, let's move to general review muscle description. So number 1, deltoid, vastus lateralis, and gluteus medius are commonly used for intramuscular injection. So that is the three muscles that is commonly used for intramuscular injection. So number 2, insertion tendon of the quadriceps femoris group contains the large sesamoid bone and the patella. So the answer is quadriceps femoris. Number 3, the gastrocnemius and soleus muscles insert in a common into the Achilles or calcaneal tendon. So the answer is Achilles or calcaneal tendon. Number 4, the bulk of the tissue of a muscle tends to lie proximal to the part of the body it causes to move. So the answer is proximal. Number 5, the intrinsic muscle of the hand originate on the forearm. So the answer is forearm. Number 6, most flexor muscle are located in the anterior aspect of the body. Most extensor are located in the posterior aspect. An exception to this generalization is the extensor flexor musculature of the knee. So the answer is anterior, posterior, and knee. So let's move on to general review muscle recognition. So let's identify the different parts of our muscles. So let's start with the anterior. This is our anterior. So number 1, orbicularis oris. So can be found here in the part of our lips, in our mouth. That is letter T. Number 1, T. Number 2, pectoralis major. So this is our pectoralis major. That is our chest. Number 2, answer is V. Number 3, internal oblique. So this is our internal oblique. So answer is X. Number 4, sternocleidomastoid is located here in our neck area. So that answer is U. Number 4, bicep bronchi. So this is our bicep bronchi. So the answer is G. Number 6, deltoid. So deltoid is located in our shoulder area. So that is answer is E. So next, 7, vastus lateralis. So vastus lateralis is located here So that is a vastus lateralis. So number 10, number 7 is L. So number 8, frontalis. So frontalis is located in the head area. So specifically here, that is our frontalis, or we all know that is forehead. That is our forehead. So frontalis, number 8, answer is Q. Number 9, rectus femoris is located here. That is our rectus femoris in our leg area. So number 9, answer is K. Number 10, rectus abdominis. So here is our rectus abdominis. It is located in the abdominal area. So answer is W. So next, sartorius. Number 11, sartorius is located here. That is our sartorius in the leg, our muscle in our leg. So next, 12, platysma. So platysma is located here in the neck area. That is our platysma. Next, 13, flexor carpi radialis. So flexor carpi radialis is located here. That is our flexor carpi radialis. So from its word flexor, so it flexes our wrist. Number 14, orbicularis oculi. So this is our orbicularis oculi is located around our eyes. So this is the answer is R. Number 14, or 15, gastrocnemius. So this is our gastrocnemius. We all call it bagtak. So that is our gastrocnemius. The answer is CC. So next, masseter. So masseter is located here in the part of our face, like in the cheek. So that is our masseter. So let's move on to number 17, trapezius. So trapezius is located in our back. So that is trapezius, but we can see a little part of it. So that is trapezius around here. So number 17, answer is D. Next, 18, tibialis anterior. So this is the tibialis anterior. Number 18, P. So answer is P. Next, adductors. So that is located here in our inner thigh. So answer is BB. Next, 20, vastus medialis. So vastus medialis is located here. This muscle and located in the knee area. So that is vastus medialis. Number 21, transversus abdominis. So this is our transversus abdominis. It is located under the internal oblique. So answer is C. Next, fibularis longus. So this is our fibularis longus, this little part of muscle here. That is letter N. Next, iliopsis. So number 23, iliopsis is located here, and this is our iliopsis. So 23, answer is J. Next, 24, temporalis. So temporalis is located here in our head area. That is the side of our head. So answer is A. Next, zygomaticus. Zygomaticus is located here. Where's the zygomaticus? Here. That is located in our cheekbone or this in face area. So next, triceps bronchi. Triceps bronchi. So is located here. Triceps bronchi. So here, behind the biceps bronchi. So that is triceps bronchi. Next, bronchialis. So this is bronchialis behind the elbow, or it is located here in cubital fossa. So answer is H. Next, extensor digitorum longus. So it is located here. That is in the lower leg. So that is the extensor digitorum longus. Next, 29. Internal oblique. So this is our internal oblique. It is under the external oblique. So answer is Y. Lastly, number 30, soleus. So soleus is located here in the lower leg. So that is answer is DD. So let's move on to the posterior. So this is the posterior. So number 1, gluteus maximus. So gluteus maximus is located here in our buttocks. That is the gluteus maximus. So answer is N. Next, number 2, membranosus is located here. That is our semimembranosus behind the knee. Next, gastrocnemius. This is our gastrocnemius. So number 3, answer is F. Next, number 4, lastimus dorsi. Lastimus dorsi is located this is our lastimus dorsi. This big muscle here below the trapezius. So this is the lastimus dorsi. So number 4, answer is K. Next, deltoid. So this is our deltoid and the shoulder area. So number 5, answer is J. Next, 6, semitendinosus is located here. That is our semitendinosus. Number 6, answer is Q. Next, trapezius. So this is our trapezius. So the answer is I. Next, 8, biceps femoris. So answer is here in this area. This is the biceps femoris. So answer is P. Next, triceps bronchi. So this is the triceps bronchi. So the answer is A. Next, external oblique. So this is the external oblique. It is still part of the external oblique in the hip area. So next, the number 11, gluteus medius. So gluteus medius is located here below the external oblique. So number 11, answer is M. Next, 12, the flexor carpi ulnaris. So 12 is located Here, this is our flexor carpi ulnaris. So let's move on to number 13, extensor carpi ulnaris. It is located here in this area. This area that is the extensor carpi ulnaris. So number 14, extensor digitorium is located here. So the answer is E. Next, number 15, extensor carpi radialis is located here. This is the extensor carpi radialis here. Next, sternocleidomastoid is located here. Sternocleidomastoid. Number 17, the abductor magnus. So number 17. So number 16 answer is H. Number 17, abductor magnus. So this is the abductor magnus. Letter O. Lastly, soleus is located here. This is our soleus. G. So that's it for our muscles, body muscles. So I can say that we have lots of muscles in our body, and every muscle working together for us to move and do things we want to do. So let's sum it up for anterior. Number 1, T. Number 2, V. Number 3, X. Number 4, U. Number 5, G. Number 6, E. Number 7, L. Number 8, Q. Number 9, K. Number 10, W. Number 11, AA. Number 12, C. Number 13, I. Number 14, R. Number 15, CC. Number 16, B. Number 17, D. Number 18, P. Number 19, BB. Number 20, M. Number 21, Z. Number 22, N. Number 23, J. Number 24, A. Number 25, S. Number 26, F. Number 27, H. Number 28, O. Number 29, Y. Number 30, DD. For posterior, number 1, N. Number 2, R. Number 3, F. Number 4, K. Number 5, J. Number 6, Q. Number 7, I. Number 8, P. Number 9, A. Number 10, L. Number 11, M. Number 12, C. Number 13, D. Number 14, E. Number 16, 15, B. Number 16, H. Number 17, O. Number 18, G.
Flexion of the shoulder occurs when angle at the humerus of arm and scapula bone decreases as arms move anteriority. Extension of shoulder occurs when angle at the humerus of arm and scapula bone increases as arms move posteriority. Flexion of the knee occurs when tibia bone moves toward femur, causing the angle to decrease the structure. Extension of the knee occurs as the angle between those leg bones increases, causing the leg to straight.
Flexion, extension, and hyperextension of arm, hand, and thigh. For hand flexion, hand extension, and hand hyperextension. For arm flexion, arm extension, arm hyperextension. And for thigh flexion, thigh extension, thigh hyperextension. That's all.
Abduction. Abduction is when the upper limb is moved away from the medial axis of the body. Adduction is when the upper limb is moved towards the medial axis of the body. And circumduction is a combination of flexion, abduction, adduction, and extension which makes the hand trace a circle and the arm a cone.
So my name is Rhea Marie S. Putong. So next is number 5, dorsiflexion and plantar flexion. So these are the terms used to describe movements at the ankle. So first is the dorsiflexion. So dorsiflexion is when you pull your foot backwards. Next is the plantar flexion. So plantar flexion is when you point your toe down to the ground.
I will show you the supination and pronation of the hand. So this is my hand. When your palm is facing up like this, it has been supinated. The action of rotating it around is called supination. Once you know supination, it's easy to know pronation because it's just the opposite. When your palm is facing down like this, it has been supinated. The act of rotating your palm around in this direction is called pronation. So, this is supination and this is pronation. Supination and pronation.
And that's the end of our presentation. Thank you for your time.